Hello everyone, I hope you're keeping well and safe during these very challenging times. The year 2020 has certainly been very challenging for everyone in Australia with catastrophic fires, storms and now a global pandemic crisis which is affecting us all. As a community not-for-profit aged care organisation, the number one priority for us is the well-being of our residents and our staff. And that's been number one priority for over 50 years. We've got now over 9,000 residents and customers that we care for around Australia, predominantly in New South Wales, ACT and Queensland. And unfortunately, older people are just more susceptible to COVID-19, and the majority of our residents are in those categories. We made a difficult decision early in the pandemic to close our aged care centres to visitors, really just to protect you and our staff. It was a very difficult decision, but it had to be made to save lives. The restrictions that we put in place helped us to reduce the risk of COVID-19. And I'm pleased to say with those restrictions and vigilant infection controls, that we have had no COVID-19 infections across all of our sites, have we, Pat? Which has been really good. We've reviewed our restrictions every week and our board has been meeting every week, and we looked at the latest information. I think it was on about the middle of May the 11th, that we opened up our aged care centres to more restricted visitations, but at least allowed family and friends to come in. I just want to thank the family and friends, the next of kin, for their cooperation during that time. And also I really want to thank our staff, Pat. They've just worked fantastically through this pandemic to protect all of our residents and themselves, and it's just been wonderful. So I'll hand it over to Pat.
Thanks, Mike. And look, thank you to our residents and customers, and also to you as the families for keeping each other safe, and also to our staff for their hard work. I think it's important through the pandemic, and particularly looking at Victoria, that we do keep the vigilance up around COVID. It's an invisible invader, and I think for us, that's probably the scariest part. Whenever we do a swab, a test, whether it be for influenza or COVID or other things, we're on tenterhooks waiting to get the results. So I know it's been hard for everybody, and I do appreciate the challenges around it, but it is important that we do maintain that vigilance to keep everybody safe and well. So I do thank you for that. I think the other thing too, I'll talk about the visitation details in a moment, just to give you an overview where we're at today and for the next little while. But we're reviewing that on a weekly basis, if not every day, around visits, and also to restrictions that we receive from state health, federal health, and obviously the PHUs in our region. So these decisions are made across the board in terms of who can come in and what the restrictions are. And then obviously looking at what hotspots are popping up as well, and they're still occurring. So we want to be very clear on that. I think too, when you look at Australia, we've been pretty lucky, but also too, it's not just luck. It's been hard work by people to keep COVID out. And I think you look at the US, older people only make up 0.05% of the total population, so 0.5% of the total population, yet they represent more than 30% of the deaths. So that's over 35,000 people have died in the US in nursing homes in the US. So, you know, the effort put in by the families, by the residents and by the staff has been phenomenal. So thank you for that. I think the other thing too, you know, visits will start to loosen up a little bit, but we are still mindful with school holidays on that travel from Victoria has been restricted into New South Wales and Queensland, of course, and also to the ACT, but making sure that if you are travelling, to follow the guidelines and make sure that you are contacting and making appointments before you do turn up, just to make sure that our staff are available to look after you. And we are looking at two things at the moment. One is Saturday visits, which I'll go through in a moment, and also to the return of hairdressers. You can see for me, it's not such a concern. In fact, somebody said to me, my hair's migrated from my head to my chin during winter. But certainly those sorts of things are beginning to open back up again, but they are being done in a COVID safe way. We're not being reckless, as you'd expect. We're making sure that we've covered every base when opening up these services. So I think for us, we're single-minded in our commitment to keep your loved ones safe and our staff safe. And that is important for us to keep continuing that. So in order to do that, we have been doing wellness checks for our employees. We started that in early March, late February, early March, around temperature checks, questions about where they've been, if they are travelling to work, coming directly from home to work, It can be that if they go and stop at the shops or drop kids off, they have to get changed at work to limit any spread of disease, all those sorts of things. So that's a big effort from staff to keep that hygiene and that prioritisation up. We have rigorous infection control mechanisms. We're very proud of our antimicrobial positions on this, and we'll continue to make sure we're doing the primary, tertiary cleaning that's required and secondary cleaning that's required to make sure everybody's safe, and that includes when you come to visit. And after you leave, we do cleans as well as soon as you visit and then leave. Of course, things like flu vax. So it's important to understand that all of our staff are offered the flu vax. It's free to them. At the moment, we sit at about 96% as of today of all of our staff who have received the flu vax. If they haven't, they're not allowed on site. We deploy them in other parts of the business, but they're not allowed on site if they haven't had their flu vax. And we also have about 99%, or not, actually it's about 99.7% of residents have had their flu vax. And again, that goes up and down as people come in and go out again. But again, the residents have been phenomenal getting their flu vax. But if you're coming to visit, please make sure that you've had your flu vax. If you haven't had it or you do not have an exemption, then you can't come on site. It's just to protect everybody with that herd immunity around flu vax. Because although COVID is our current problem, influenza A and other types of influenza can be just as devastating if they get inside our facilities. So again, just making sure we're looking after people with that. You've probably heard a lot about PPE, protective personal equipment, masks, gowns, those sorts of things. We've been working hard since basically late February around making sure we're securing adequate stocks. It has been hard, it's very expensive. It's cost us millions of dollars to do these sorts of things, which we don't have through funding. This is us dipping into our savings to do this. But it's important, I think, Mike and the board, when we look at it, if we never get to use it, then that's a good waste, to be honest. If we haven't had to use the PPE, that means we've kept everybody safe. But we do have stocks, and we're continuing to look at our stock every day. And also too, I think we'll continue to review these visitor arrangements as the time goes on. We'll loosen up where we can. We love our residents and our customers seeing people and seeing next to kin and their loved ones. That is really important to us and to them, of course. So we want to make sure that's okay. In terms of, I'll get to the granularity of the visitor restrictions at the moment, and probably the biggest one is to make sure that you are booking an appointment in order to come and see your loved one. We do have Saturday visits. Again, we have limited staff available to escort you in and out, do the questioning and the other arrangements required to do it safe. So we do require that you talk to the care manager to book those appointments. And the appointments are only 30 minutes in length, and that's been mandated to us by the health authorities around how safe it is to have people in a room and then how long they can be exposed to each other. So it's 2 visitors for 30 minutes. We won't be like the bouncer at the pub and kick him out at 30.5 minutes or 31 minutes, but we will ask you within time to wrap up your meeting or the meeting with your loved one so we can clean the room and make sure everybody's safe on their exit as well. So just to be aware of that. I think too for us, in terms of the number of visitors, as I said, it's only 2 and nobody under 16. At this stage, we are seeing that children or young adults, whatever they like to be called, under the age of 16 are still an asymptomatic risk. And hence we won't be allowing them into our care centres at this stage. It will come. I know grandchildren, great-grandchildren bring a huge amount of joy to our residents, but at this stage they still present too large a risk for us to allow them in. And really in terms of the entry to the site, you'll find there's only one entry in. In the past you may be able to come in from multiple parts of the building. We now have a dedicated entry point because we need to go through the questions that we have to ask you in order to be COVID safe. And in some sites we are rolling out an electronic entry system which will allow you to run through the questions. It'll take a photo of you just for safety and security, and then to place a sticker on your clothing so we know that you've answered all the questions, you've had your temperature checked, you've got your flu vax, and you are free to come and see your loved one. So just to abide by that, please, if you're able to. We will do those wellness checks, and obviously if you're feeling unwell, it could be a runny nose, a bit of a sore throat, bit of a headache, you're just feeling a bit off, please don't come in. We'll rearrange the visit for you. We'll make sure that we give you some other access. We can also do telehealth in terms of picking up an iPad, or the good old phone call if we need to. But certainly if you're feeling unwell at any time, please refrain from coming in to the site because it does place people at risk. In terms of hand hygiene, we will ask you to wash in and wash out. So that means using the hand sanitizer that's available on entry, and then as you leave, because we don't want you taking anything home in case there is a risk there, making sure you are using your hand hygiene. And we have got dedicated areas, so you can meet with your loved one in their room, and that'll be their designated single room. Within a visitor room, which some of our sites have already set up, which are very comfortable, allow for you to sit there in comfort, or outdoors. If it's a lovely day and we're getting warmer, hopefully, now we've passed the solstice, you will be able to sit outside as well, where it is COVID safe. So just making sure we've got that done. And of course, staff and residents will hopefully be able to enforce that 1.5 metres. So important in social distancing. We know the droplets, etc., do transmit via that space. So if you're wondering why we're trying to keep you a little bit separated, as we saw from Victoria, the hugging and the kissing is problematic. We know you want to give them a big squeeze and show them the love, but it is a problem in terms of transmission. So although it's uncomfortable, the 1.5 metres is so important as well. If you do want to drop off gifts and flowers, those sorts of things, that is absolutely fine. The only thing we do ask is if they're able to be wiped down. So they're in packaging that allows them to be cleaned. It's important that we do disinfect them when they arrive, just to make sure. It may not be from your home, it could be from wherever you pick them up from, just to make sure we can disinfect them and keep everybody safe. And flowers, of course, they're cellophane, all those sorts of things, just so we can wipe it down and keep those gifts as safe as possible. And one of the things we are looking at is outings. We know that you're free to take your loved one out. The problem is when they come back. We're trying to make sure that outings are only those that are absolutely unequivocally necessary. So doctor's visits, those sorts of things are okay. But trips to the pub, trips to the club are out of the question. We're really asking for your support in this because we've seen, again, hotspots are normally generated by close contact in clubs and pubs and those sorts of places as well. So trying to keep people safe. We don't want to have to put them into 14 days of isolation in their own room, all those sorts of things if we do find out later that there's an issue. So we do ask for your support in that. And really the main thing being, check in with the care manager. If you have any questions, the care manager and the staff will be more than happy to help you. And we're looking forward to keeping everybody safe and hopefully returning to the new normal where we can all get back together. You can give everybody a kiss and a hug and get back to see your loved one face to face and in person. So thank you so much for your support. As I said, any questions, please talk to the care manager at your site. And Mike and I, we'll keep doing our best to keep your loved one absolutely as safe as we can. And also to making sure that they're feeling connected to the community and to those that they love. So thanks again, and we'll talk to you soon.
Yeah, thanks everyone.